Hello, my name is Paisley Robinson and I'm going to be performing my NG insertion skill video. I'm going to make sure that I follow my general principles and safety practices along with my two patient identifiers. I've also already checked the order and confirmed what we're doing. So then I'm going to enter my patient's room. Hello, my name is Paisley. I'm going to be the nurse taking care of you. Can I get your name and date of birth? I'm going to check that against the wristband, that it matches. Good. Do you have any allergies? They don't have any allergies. I'm going to explain what I'm going to be doing. So I'm going to be inserting an NG tube. Is that okay? Good. So they gave me permission. I'm also going to assess my patient, make sure that they don't have any facial fractures, any abnormalities, and that their nose isn't stopped up, and it isn't. I would wash down my table and set up my supplies, which I already have. I'm going to perform hand hygiene and put my gloves on. So then what I'm going to do is I'm going to measure, starting at the tip of the nose, going around the ear, the back of the ear, and down the earlobe, all the way down to the xiphoid process. And then I'm going to mark with a marker. Then I'm going to lube up the end of the NG tube. I'm going to have my patient tilt their head back. I'm going to introduce it into the nostril until I get to the back of the throat or the pharynx. Then at this point, I'm going to have them put their chin to their chest, and I'm going to have them swallow. At this point, I would offer them water if they needed it, and they're not NPO, so they are allowed to have it. So I'm going to have them swallow, swallow, swallow. At any point, if this was uncomfortable to them, we would discontinue the procedure. So as they're swallowing, I'm going to stop once I get to my mark, and then I'm going to place a temporary piece of tape there to secure it in place. Now at this point, I would go ahead and get x-ray to confirm placement. I have my pH strip in my basin ready to go. So I'm going to move that, and I'm going to aspirate just a little bit of stomach contents. And I'm going to place it on the pH strip. And it has come back within normal limits at a 4. My x-ray has been completed and placement has been confirmed. So then at this point, I'm going to do another measurement. So I'm measuring from the tip of the nose to the end, and we are right at 21 inches. I'm also going to go ahead and make another mark. Then I'm going to hold at the nostril, making sure that I don't let go, and I'm going to secure it. So now it is good and secured. I'm going to put just a little extra piece of tape there over the nose, and at this point you could go ahead to and put some barrier cream around the nose just to make sure that doesn't get irritated. Then just for the comfort of the patient, I'm going to pull this around and tape right there to the cheek. And then at this point, I'm going to go ahead and turn my suction on, low suction. Test the suction, make sure that it's working, and it is. Hook it up, and then I'm going to make sure that my vent stays above the stomach, and I'm going to secure it to my patient, making sure that that vent stays above the stomach. Then I'm going to evaluate my patient, make sure that they're doing okay. They are. That suction's running appropriately. I'm going to remove my gloves, perform hand hygiene, and then I'm going to document and report and record.